Thousands of seniors on this channel have already discovered what magnesium oil does for back pain overnight. The results speak for themselves in the comments section of that video. Tonight, I am building on that discovery because one of the most consistent questions this community has asked is this: what else can I add to my magnesium protocol to make it even more effective? The answer is zinc. Not instead of magnesium, alongside it, because zinc addresses the one component of overnight back nerve repair that magnesium does not cover: the antioxidant protection of nerve cell membranes from the oxidative damage that chronic inflammation produces. 2 minerals, 1 spray, the same bedtime routine you already have, and a morning back pain result that builds on everything magnesium has already been doing for your nerves. Tonight, everything about this 2-mineral upgrade. And real quick, if someone you know has been using magnesium oil for back pain and wants to take their results even further, pause right now and send this video to them. And if you are not subscribed yet, hit that subscribe button right now. Every week this channel builds on what works and gives you the next level. Now let us get completely into this. My name is Dr. Michael Kent, and in 20 years of senior health practice, I have been fascinated by the synergistic relationship between minerals and their specific roles in overnight nerve repair. Magnesium and zinc are 2 of the most critically important minerals for back nerve health, and they work through completely complementary mechanisms that together provide overnight nerve support that neither mineral achieves alone. Tonight I am explaining that complementary relationship completely and giving you the exact protocol to combine them into the most effective overnight back pain mineral spray available from a single bedside bottle. Before the science, let me share a story that reflects what many patients in this situation experience. All details have been changed to protect privacy. A patient came to me, a senior in their early 70s, who had been using magnesium oil spray on their lower back every night for approximately 3 months. They were enthusiastic about the results. Their morning stiffness had reduced noticeably, the quality of their sleep had improved, and their baseline back pain score had declined from a consistent 6 to a consistent 4. Real results, meaningful results. They were grateful for the protocol and committed to continuing it. But they had a question. A very specific question that I hear regularly from patients who have experienced genuine benefit from magnesium oil and who are slow about what else is possible. They asked, is there anything I can add to the spray that would take it further? That would address the part of my back pain that the magnesium has not yet fully reached? That question led to a conversation about zinc, about what zinc specifically does in back nerve tissue that magnesium does not cover, about the zinc-dependent superoxide dismutase enzyme system that is the primary antioxidant defense of back nerve cell membranes, and about how deficient most seniors over 60 are in the mineral that powers this defense system. I suggested adding zinc chloride solution to their existing magnesium oil spray at a specific concentration. They tried it for 4 weeks. At their follow-up appointment, they told me their morning pain score had declined from the 4 it had reached with magnesium alone to a consistent 2 to 2.5. The stiffness that magnesium had reduced but not eliminated had reduced further. The burning quality of their deeper back nerve pain, which magnesium had quieted but not silenced, had quieted further still. Same bedtime routine, same spray bottle, 1 addition, and a morning result that went meaningfully beyond what 3 months of magnesium alone had achieved. Now here is what makes zinc so specifically complementary to magnesium for overnight back nerve repair, and why the combination is so much more powerful than either mineral alone. Magnesium works primarily at the pain receptor level. It stabilizes NMDA receptors, the molecular channels on nerve cells that, when overactivated, maintain the chronic pain sensitization driving back nerve hypersensitivity. When magnesium is present in adequate concentrations in nerve tissue, it physically sits inside these NMDA receptor channels and blocks the excessive calcium influx that keeps pain signaling running at high levels. The result is a calmer nerve, one that fires less easily, transmits pain signals less intensely, and allows deeper, more restorative sleep because the pain threshold is raised. This is why magnesium oil applied before bed produces the specific overnight improvement that thousands of seniors on this channel have described. the morning stiffness and pain that greeted them every day becoming noticeably quieter and less demanding. But NMDA receptor stabilization is only one part of the back nerve's overnight needs. There is a second part that magnesium cannot address, and that is where zinc becomes essential. Your back nerve cells, like every cell in your body, are under continuous oxidative attack from reactive oxygen species produced by chronic inflammation. These reactive molecules are generated by the inflammatory process surrounding the compressed or irritated nerve root, and they attack the nerve cell membranes, the myelin sheath, and the mitochondria that power nerve cell function. Your back nerve has a built-in defense system against this oxidative attack, a family of antioxidant enzymes called superoxide dismutases. The most important of these for peripheral nerve protection is manganese superoxide dismutase inside the mitochondria, and the equally critical copper-zinc superoxide dismutase in the cell cytoplasm, SUP. Both require specific minerals to function, and the copper-zinc superoxide dismutase, which is the primary defender of the nerve cell membrane against the reactive oxygen species most directly associated with chronic nerve inflammation, requires zinc as a structural component to maintain its active form. When zinc is deficient, which research published in the journal Nutrients has confirmed affects a significant proportion of adults over 60 due to age-related decline in zinc absorption efficiency, copper-zinc superoxide dismutase activity falls. The antioxidant defense of the nerve cell membrane degrades. Reactive oxygen species accumulate in the nerve tissue. Membrane damage accelerates, myelin integrity deteriorates, and the back nerve pain becomes progressively more treatment-resistant as the nerve's own defense systems fail silently due to a mineral deficiency that most back pain treatments never address. Zinc applied transdermally in a combined magnesium and zinc spray reaches the nerve tissue through the same skin penetration pathway that magnesium uses, and restores the zinc availability that copper-zinc superoxide dismutase needs to protect the nerve cell membranes from oxidative damage during the overnight hours when the body is doing its most important cellular repair work. The result is exactly what the patient in our story experienced: magnesium quieting the nerve's pain signaling while zinc protects the nerve's cellular integrity, two complementary protective mechanisms working simultaneously from a single bedside spray bottle. Research published in the journal Biological Trace Element Research found that combined magnesium and zinc supplementation produced significantly greater reductions in peripheral nerve pain markers than either mineral alone, with the combination specifically addressing both the neurological excitability component of nerve pain and the oxidative membrane damage component through their respective and non-overlapping mechanisms. This research confirms precisely what clinical observation shows. These two minerals are not redundant, they are complementary. They cover different biological territory, and together they cover the complete overnight repair needs of the chronically inflamed back nerve. Now here is the third benefit of the combined zinc and magnesium spray that neither mineral provides independently. And this one specifically addresses the morning stiffness that so many back pain sufferers describe as their worst daily symptom. Zinc is an essential cofactor for over 300 enzymatic reactions in the body, including the synthesis of collagen in spinal disc and ligament tissue. The intervertebral discs and the posterior longitudinal ligament of the lumbar spine, structures that directly affect the mechanical compression of back nerve roots, require continuous collagen synthesis to maintain their structural integrity. When zinc is deficient, collagen synthesis in these structures slows. Disc and ligament tissue degrades progressively. The mechanical compression of nerve roots worsens. And the morning stiffness, which reflects both the overnight inflammatory accumulation in nerve tissue and the mechanical compression from deteriorating spinal structures, becomes more severe. Transdermal zinc delivery from the overnight spray supports the local zinc availability for collagen synthesis in the spinal structures closest to the application site, providing both the antioxidant nerve protection we have discussed and a structural support component for the spinal tissues, generating the mechanical component of back nerve compression. Research published in the Journal of Trace Elements in Medicine and Biology found that zinc sufficiency was directly associated with better maintenance of intervertebral disc collagen content in adults over 60, confirming that zinc adequacy is a modifiable determinant of the structural spinal changes that contribute to back nerve compression and morning stiffness. Here is exactly how to make and use your 2-mineral overnight back pain spray, with every detail specified. You have 2 options for creating the combined spray. The first and most convenient option is to purchase a combined magnesium and zinc topical spray. Available at health food stores and on Amazon under brands including LifeFlow Magnesium plus Zinc and Ancient Minerals Magnesium with Zinc, both of which provide pharmaceutical-grade magnesium chloride and zinc chloride in a pre-formulated transdermal spray at therapeutic concentrations. Apply 10 sprays to the lower back and lumbar region every night before bed, exactly as you currently apply your magnesium oil. The addition of zinc requires no change to your application routine. The second option, for those who already have existing magnesium oil and want to add zinc to their current bottle, is to create your own combined solution. Purchase zinc chloride powder from a reputable supplement supplier, available on Amazon and at specialty supplement retailers. Dissolve 1 gram of zinc chloride powder in 100 milliliters of your existing magnesium chloride solution. This produces a combined spray with approximately 1% zinc concentration alongside your existing magnesium concentration, a ratio consistent with the concentrations studied in transdermal mineral research. Stir thoroughly before each use, as zinc chloride may settle slightly between applications. Apply 10 to 12 sprays of the combined solution to the lower back, specifically covering the sacroiliac joints bilaterally, the lumbar paraspinal muscles, and extending to the upper buttock region where the nerve roots transition into the sciatic nerve pathway. Massage gently for 60 seconds after spraying to enhance absorption. Then apply a thin cotton layer over the treated area and go to sleep. The overnight absorption period, 6 to 8 hours of sustained skin contact, allows both magnesium and zinc to penetrate to therapeutic concentrations in the nerve tissue beneath. Give the combined protocol 4 weeks of consistent nightly application before comparing your morning results to your results from magnesium alone. Track your morning pain score every day, the moment you get out of bed before movement loosens things up. Most people notice the additional benefit of zinc beginning to manifest between weeks 2 and 3, as tissue zinc concentrations build to levels where copper-zinc superoxide dismutase activity is meaningfully restored. The improvement typically presents as the deeper burning quality of back nerve pain, the component that magnesium has been reducing but not fully addressing, becoming quieter and less demanding during the morning hours. In 20 years of practice, the patients who achieve the most complete and most sustained resolution of chronic back nerve pain from overnight mineral spray protocols are consistently those who address both the neurological excitability component through magnesium and the oxidative membrane protection component through zinc simultaneously. Neither mineral alone covers the complete picture. Together, they cover everything your back nerve needs from a single spray bottle applied in 2 minutes before bed every single night. Magnesium gave thousands of seniors on this channel better mornings. Zinc gives those mornings another level. Same routine, same spray bottle. 1 addition, starting tonight. Now, before you go, drop a comment right now and tell me your age and your city. And tell me, have you been using magnesium oil already? Are you going to try adding zinc tonight? I read every single comment personally. Share this with someone who has already discovered magnesium oil for their back pain and who is ready for the next level of overnight nerve support. Subscribe and turn on notifications, because every week this channel builds on what works and gives you what comes next. 2 minerals, 1 spray, 10 sprays before bed, starting tonight. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Zinc chloride should never be applied to broken or irritated skin. Perform a patch test before full application. Excessive zinc exposure can cause skin irritation. Do not exceed the recommended application amount. Always consult your healthcare provider before adding new mineral supplements to your protocol, especially if managing kidney conditions or taking medications affecting mineral metabolism. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.